Good afternoon, Milwaukee, and welcome to ListenMKE, a partnership between WUWM, Milwaukee's NPR, the Ideas Lab at the Milwaukee Journal-Sentinel, the Milwaukee Public Library, and Milwaukee Public Television. I am investigative solutions reporter Talis Shelbourne with the Milwaukee Journal-Sentinel, and I am joined by a panel of doctors who are here to talk about vaccine hesitancy. Throughout this ListenMKE, we'll also be answering questions from Milwaukeeans, thanks to special reporting from Sarah Volpenheim. With us today, Dr. Lyle Ignace, the CEO of Gerald L. Ignace Indian Health Center, Dr. Kevin Izard, Chair of Family Medicine at St. Joseph's Hospital and former president of the Cream City Medical Society, and we have Dr. Zeno Franco, an associate professor at the Medical College of Wisconsin. All of you have worked on outreach this past year and have to provide good information about preventing the spread of COVID-19 and also getting vaccinated against this disease. So to get started, I'd like each of you to take a moment to briefly describe your experience with vaccine-hesitant patients. We'll start with whoever's in my top right corner, and that is Dr. Ignace. So that's you, yes.
Yeah, welcome. Thank you, and appreciate being on the show. Thank you for the opportunity. So, yeah, with the launching of the vaccines with Moderna, Pfizer, J&J, we've had all types of reasons why individuals didn't want to get vaccinated, and their hesitancy, generally revolves around the idea that this was generated too fast. Wasn't FDA approved? Is it safe enough? And a general mistrust of authority figures in promoting the vaccine, and that's really how this has been going, especially over the last 3 months. It's pretty significant, and but we try to be as informative as possible and get the information out and assure that the general public as a whole and our communities of color understand the importance of getting vaccinated.
Dr. Franco, what has been your experience?
Yeah, I think it's the same things that Dr. Ignace is mentioning. There was a lot of interest early on, and then we saw a significant drop-off in people getting the vaccination. There are all sorts of concerns out there about the vaccine. I think one of the mistakes that we can make as a society is sort of brushing off those concerns and not dealing with them seriously, sort of trying to say, well, these people are not acting rationally, and so we're just gonna write it off. I think sometimes people just need a little bit more intensive conversation about sort of, exactly, again, what Dr. Ignace was mentioning, like how was the vaccine developed? A lot of people don't realize that there's been a lot of work done on mRNA technology over a 10-year period or more, leading up to this vaccine. So, when we kind of brush off the conversation, I think that's when we get stuck.
Gotcha. And last but not least, I want to make sure I'm pronouncing this right. It's Dr. Izard or Izard? Dr. Izard. Okay, yes. What has been your experience with the vaccine hesitant patients? Oh, I think you're muted. Not quite sure.
I am muted. Okay. Yeah, so they both hit it right on the head. It's issues of mistrust, issues of misinformation. But I think the hardest part right now is running into a lot of people who consider this a civil liberties issue. And unfortunately, the harder you push, the harder they push back. And regardless of what information you give them, regardless of what information you can show them, that's convincing, it just becomes an issue of you can't make me do it. And the more you try to make me do it, the more I'm not going to do it. And so, so unfortunately, we can educate people about some of the misinformation, and as far as the mistrust, that's a harder issue also. But definitely, if people are dead set against it, there's not a whole lot you can do to convince them.
Gotcha. And so I'm going to tackle something that you just brought up, Dr. Franco, which is a question that we have from Brianna Fabry.
I think one of the interesting things that I heard about the podcast was the fact that there was research being done for so many years before the mRNA or whatever it is actually implemented in the vaccines. So I think that would be good for people to hear about, that this isn't just something that they're just throwing out. Like there's been research for years and years on this. And I don't know the specifics, so I guess I'd be interested in learning more about that. But I think it could help other people feel more comfortable with it too.
Yeah, so can you talk about the research behind mRNA vaccine technology and how long that took and how that led to the vaccine?
Yeah, I can jump in for just a second on that if you want. So, I think one of the things that we've been doing here from the medical college, working with the city and the County Office of African American Affairs, for example, is really trying to do outreach to 4 minority communities. And you can see my generation there using that term instead of communities of color. I'm one of a handful of Hispanic faculty at the medical college. And so, I've been kind of heavily involved in trying to work on this in the South Side. But we've also been trying to work in the African American community, in the Southeast Asian community, and in the Native American community through Advancing a Healthier Wisconsin Foundation grant that was completed just a few months ago. Actually, it was a rapid response grant in trying to deal with COVID right when it started to happen. And I think one of the things that we were really working on is trying to engage community health workers to have this conversation about COVID prevention and then later the vaccine. And so one of the things that community health workers really told us, and these are folks from the community who are, bilingual, bicultural in their particular community setting. If they're from a region that doesn't speak English, we were working with African American community health workers who have a very solid reputation of working in the community over a long period of time and are very trusted. But even those community health workers had questions about mRNA technology. And so I talked with Moderna and Pfizer representatives and said, hey, look, we need to have a better understanding about this. And one of the things they told us is, we're happy to talk to you, but we can't really talk to the public because we're under an emergency approval. And we don't have permission from the federal government to really describe this. So we need actually to have your help in talking through some of these things around the mRNA technology. And that's how I really started to realize that they've been working on this for 10 or 12 years, and it even goes back further than that. And there's some dynamics around the way mRNA technology works that are also really important, I think, to helping people understand that there is very low risk. But we haven't really been having that conversation in a way that's understandable for the average person to get. It took me some time to kind of think through what does this mean? And I've had a fair amount of college, right? So we need to think about how to translate those messages about the risks or lack of risk with mRNA in a way that's easy for people to really get their hands around.
Gotcha. And we do want to remind people they can ask questions in the Facebook comment section. And we do have, I'm going to ask the next question, then I'll grab that Facebook question. One is from Audra Bond, a Milwaukee resident, was wondering 2 things: where they make the vaccine and how do they know that it works? So that was one of the questions that Mr. Bond had. Who wants to grab that one?
Well, I can maybe take a stab at that. So, the vaccines are, they're major. So one of the advantages of having the mRNA technology is that with the old technology we had, like with the flu shots, at least the older ones, we'd have to use animal models. So we'd have to grow the virus on chicken embryos. Because this is a new technology, this mRNA, they can actually just mix this stuff up in a test tube, and so you don't have any animals, at least at this point, involved in the manufacture of it. The question about how do we know it's safe? It is a new vaccine. It is a relatively new technology, but as Dr. Franco was saying, back in 2003. There was a virus that caused a lot of concern, SARS, and we call this virus, the one we're dealing with now, the coronavirus, is SARS-CoV-2. And the reason why it has that name is because there was a SARS-CoV-1, and that was SARS, the initial infection that we were afraid was going to become pandemic like this was. It did not become pandemic. It wasn't as contagious, and people did jump on it right away. But because of that, there was a lot of concern that this was going to become a pandemic infection. It was novel, meaning that no one had exposure to it or immunity to it. And so they started working on vaccines then, And so some of this mRNA technology really began back in 2003 when that outbreak happened, even before then. So as Dr. Franco was saying, this isn't really anything that just started back in January. This actually, January of 2020, this actually started, back in 2003. And because there was no incentive, because it didn't become a pandemic, there was no real incentive for the researchers to get this thing to market, because there was no one was getting vaccinated for it because there was no pandemic. So when this pandemic happened and people realized it was a very similar virus, the government said, look, we need to have a vaccine. And it said, whatever you're working on, we will pay you, we will incentivize you to finish the research and to get it to market. And so it makes sense that, you had a lot of collaboration and there was a big push to get this thing out. But again, it wasn't because, this was made completely whole cloth, beginning after this pandemic started. It really was already there. There was just no incentive to get it done. And so they did combine a lot of steps, as far as getting and now this gets to the second question about how do we know it's safe? So there are normally, when a new medication comes out or a vaccine, there are clinical trials where we get volunteers who volunteer to take a medication or a vaccine, and we follow them over a period of time, and we find out, first of all, is it safe? Does anyone have any bad reaction to it? And then secondly, is it effective? And then they try to figure out, okay, what's the best dose to use it? So because this was such an urgent issue, they combined some of the steps. And so normally they have to recruit people to get into these studies, but because there was the pandemic was out there were people lining up to say, yes, give me the vaccine, I'll try it, I'll be the guinea pig. And so there was no lag in getting recruiting people for the studies. And because there was sharing of information, there was no problem with people trying to get data together. So a lot of this stuff really got combined, and so the efficacy, meaning whether it's safe, or the efficacy, whether it's effective, and the safety studies were done together. And so probably the best argument for the safety of this vaccine is that we've had almost 2 million people who have been vaccinated against this, and there are very few medications that have that big of a study group. They'll tell you whether it's safe and effective. And so, if there's something bad, it would have shown up, a lot earlier. And so overall, when you weigh the risk of this new vaccine versus the risk of having a bad outcome from COVID, your risk of having COVID is a lot higher than any possible risk that you're going to get from this vaccine, especially after having so many people have gotten it. So that was what convinced me, was the fact that definitely the benefit of this medication outweighs any risk that there would be.
Gotcha. And we've got a question from Facebook from Kathleen McGuire. She wants to know, what do you think of Biden's urging to do the right thing? Is it possible that can combat the civil liberties mindset, or people don't want to take it and consider the civil liberties issue? Whoever wants to take a shot at that one, go ahead.
Well, that brought the civil liberties issue. I definitely think that as a healthcare provider, we are basically mandated to take the flu shot every year, make sure that our vaccines are up to date, to wear masks, and we do it for the safety of our patients. And so I think we have to get to a point in our society where it's not about us; it's about the common good. And this is the issue I think that people have a hard time getting their head around, is that, on an individual basis, you have a 99% chance of surviving this. If you get the COVID, if you're going to have a 99% chance you're going to survive it and not die. 1%, that's pretty good. 1% chance of death, 99% chance of surviving. And that's not really paying attention to considering the long COVID symptoms. People who years later or 6 months later are still having problems with memory and fatigue and things. But when you look at instead of looking at individuals, look at population. Okay, if you were the person who was in charge and they said, okay, we got a virus out there, it's going to kill 1% of people, but 99% of people are going to survive it. On an individual basis, it sounds good, but when you consider that there are 330 million people in the U.S., and if 1% of them die, that's 3.3 million people who are going to die from this, and that is unacceptable. So, from an individual point of view, you might say, yeah, I would do the risk of 99% versus 1%. But from a population point of view, it's not that cut and dry. So we do this for not just for ourselves, but we do it for our collective selves. Not everybody is young and healthy. There are people with chronic illnesses. There are people who can't get the vaccine, like children under 12, or people who have maybe some immunity issues or can't take the vaccine. And so the reason why we mask up and we take the vaccine is protect the other people around us. So we got to get out of this mindset about it's just us. It's really about us collectively.
Gotcha. And next we're going to go to a question from Megan Frericks. And if we can show that video.
What does the FDA approval change? Like, we have that approval now, and like, what makes the difference between having that approval and not?
So I'll ask Dr. Ignace to jump in here and explain the difference.
So up until a couple of weeks ago, we've been under the emergency use authorization from the FDA. And this was important in not only assuring that clinical trials were not only show its safety, but its efficacy. So for Pfizer or any of the vaccine companies to submit, they also need to submit for FDA approval, which goes a long way in its not only demonstration, but also the full stamp of approval from the FDA to assure its effectiveness and safety. So having that designation now, from a federal standpoint for the entire country, makes a big difference. Certainly makes a big difference in people's mindset of, this is still being tested or it's still being used as a clinical trial. No, that's all over with, and now it's fully approved, much like all the other vaccines that we administer to individuals throughout their life. This designation really opens the door for a lot of different approaches, knowing that there's full approval. So that's important. It's an important designation, and providers from all walks of life can certainly use that as an effort to assure people that this is safe.
Gotcha. And next up, we have a question from Mount Mary University student Alexis Kane. If we can show that video.
How can you ease the minds of people who are concerned about negative long-term effects of the vaccine?
Yeah, I can jump on that one a little bit. So, I mean, again, we actually had some questions from the community health workers that we were working with exactly about that question. Do we really know what the long-term effects are from an mRNA-based vaccine? And I think, we're relatively assured that the sort of short-term effects are minimal, right? There are some side effects. And I mean, I think that's one of the things we have to be honest and open with the community about too.
Right.
We know that there will be a few people that do have some side effects from any vaccine. That's just reality, right? We don't have a complete picture on long-term safety for the current vaccine. That's also a reality. And I think we need to be open about that. We have every reason to believe that this vaccine won't impact people much beyond a couple of days where they're having some immediate side effects. But we don't have complete data yet on the long-term effects. And I think that we need to tell people that, right? And we're trying to work on that. And that's really where we actually are starting to now have the vaccine in place for many months, and we're starting to see safety data that's getting to be longer term. What we understand about mRNA is that it's not able to go back into the cell nucleus, right? It's something that's transported actually away from the cell nucleus. And so I think one of the biggest concerns that I've heard in the minority communities, the communities of color that I work with, is that somehow this vaccine has been designed to alter human DNA, right? And that's a concern that's come up many, many times in very different contexts. And I think we, as a healthcare establishment, as healthcare institutions, we have to do a better job of actually translating what we know about how mRNA transport works, again, so that the person on the street who's concerned about these sort of long-term effects can really get their hands around the idea that there's no change to the cellular structure that is, I think, one of the deepest concerns that people have. And we forget that when something is novel as this vaccine is, it's natural human instinct to be a little bit wary, right? We're not sure. That's the sort of high consequence, low information scenario is where people naturally are going to be concerned. And we have to meet that with as much information as we have and also be honest about what we don't know yet.
Gotcha. And we've got a question from Gail Wells. It's regarding the adverse event reporting system. They have a question wondering about actual adverse events and deaths. Can you talk a little bit about how that works? It's not something I'm very familiar with, but how that works and how it's related to the vaccine. Whoever wants to jump in.
I'm not familiar with that study, but I wouldn't be surprised. Anytime people voluntarily report something, you're going to get very variable buy into it, and so I think with this situation with COVID-19, with the vaccinations, I think people are really concerned about it, and that they are more likely to report if something happened. In fact, if there's any bias, most likely it will be people that are having a bad outcome would be more inclined to report it. So I really don't believe that we're missing any deaths. Anybody who got vaccinated and died from the vaccine, I would be shocked if that happened and no one reported that. It just isn't consistent with our healthcare system and with human nature. So I wouldn't be concerned about that. You also have to be concerned, be careful about the information that the raw data that's in theirs, because it reports anything that happens. So not necessarily if someone dies and they got vaccinated, it doesn't mean they died from the vaccine. They could have had a heart attack, they could have had something else going on. So you have to be careful with that data.
Just to follow up on just as a follow-up. So, I'm not sure when the Harvard study was conducted, if this was pre or post, but the VAERS system data reporting is self-limited, which, without it being, directly reported from a provider into the system, people can over-report symptoms or incorrectly report their adverse events, or if they're even considered adverse events. So I think we need to really take, data that comes out and look at it with a grain of salt, because some of this information can certainly be misleading and can skew results.
Yeah, and Dr. Franco, when we spoke in an interview earlier, one of the things that you did mention is helpful is talking to people who have been vaccinated, talking to people they know about what symptoms they experienced, just because that's a lot more probably a lot more relatable than something that you might not fully understand.
Absolutely.
Gotcha. So I just want to remind people, this is an installment of ListenMKE, a partnership between WUWM, Milwaukee's NPR, the Ideas Lab at the Milwaukee Journal Sentinel, the Milwaukee Public Library, and Milwaukee Public Television. I am investigative solutions reporter Talis Shelbourne with the Milwaukee Journal Sentinel, and I am joined by Dr. Lyle Ignace, Dr. Kevin Izard, and Dr. Zeno Franco, who are here to talk about vaccine hesitancy. You all work in the fields of outreach. So this is a question for all of you. What advice would you give people who have vaccine hesitant friends, family members, and are concerned about them, want to encourage them to get vaccinated, and want to do it in the best, most effective way possible?
I'll take certainly a try at this. So I think it's important to contact your healthcare provider, because they're more than likely going to be the individuals that have the latest information and have a much broader perspective and be able to answer people's questions directly in the moment. So, we could certainly talk to groups of people, but when it comes to more of the interpersonal relationship between you and your provider, I think it's important, and having the moment to be able to ask and have all your questions answered in the moment is certainly a lot more powerful one-on-one.
I agree, and you know, when you do the research, because we live in an age now where you can Google almost anything. You know, use reputable sites. You know, use the CDC, use places that, you know, that have reputable information versus, you know, Joe's COVID site. You know, because anybody can do a blog or do a start a website and have information that's not necessarily accurate. And I also would resist this temptation, because a lot of us are getting compassion fatigue. You know, we kind of dealt with this. We've been dealing with this. We got to a point where it looked like things were getting better. We got to take our masks off, and now the masks are back on, and people are frustrated. And so, you know, I would say resist the temptation to blame and to fight about it, because again, all your happens, kind of going back to our civil liberties issue. People just dig their heels in more strongly, you know, if you feel like, you know, you're making them do something. And so, you know, incentives, we try to incentivize people. You know, we're giving $100 in Wisconsin if you get vaccinated. You know, so we're trying to use the carrot. In some cases, only the stick's going to work. You know, so companies mandating people to get vaccinated or to be tested. You know, but again, try to resist that urge to strike out in anger, because nothing comes of that.
Yeah, I think all those things, right? So I think talking with the provider is super important. A lot of people really respect their providers as a sort of authority on this stuff. And so I think for the healthcare system and for all the work that we're doing, asking people, can you just go talk to your primary care provider about it, so you have a better understanding from somebody that you trust. That's a huge thing. I also think that we have, I think in COVID, seen a lot of personal leadership come up, right? And so I've watched individuals from communities of color that I am working with just tell their story, right? Just say, this is what I'm doing, rather than saying, you should do X, Y, Z thing. I work with a African-American executive director of a nonprofit here in Milwaukee. And, you know, he's just a guy that a lot of people know. And so what did he do when he got his first vaccine shot? He took a picture of it. This was very early days, right? And he put it up on Facebook. And I mean, you know, there he is in his t-shirt or whatever, you know, it's more, it takes some risk to just sort of put up this very personal shot of you getting the vaccine dose, right? And about 68 people commented on it and asked questions. And for me too, when I went and got the vaccine, kind of based on what he was doing, I said, this is how he's approaching it. I actually talked through the symptoms that I had from the second dose with all of my neighbors, right? I had a little bit of muscles, sort of soreness and some stiffness for maybe 90 minutes or 2 hours, and I was a little tired. And I just said, this is what I experienced. I didn't have anything in the first dose. This is what the second dose looked like. And when I go back and talk to them now, I say, you know, I haven't had any problems since that time. And I think that helps people. I'm not telling them you should do this, right? I'm saying this is what I experienced, and it wasn't a big deal. But I also think that, you know, I had a neighbor who said, I don't mind getting the vaccine for myself, but I do have some worries for my daughter, right? And we have daughters that are about the same age. And it actually made me pause and think about this for a minute, right? I'm old, you know, if something goes wrong, it's not that big of a deal. I've lived my life. But you've got young children in your home, and you're thinking, are there long-term consequences for these kids? And we had to really think about it for a minute. We don't know everything about this vaccine. But to the point that the physicians on the call are making, right, is that the risks for getting COVID are so much higher than the risks of the vaccine. And we made a decision in our house that even though we don't have every single fact in place, I don't want my kids to experience long-term COVID. I don't want them to, you know, have any of the problems that are associated with this infection. And they're going back to school. And I mean, I hate to say, but schools, on a good day, schools are a petri dish. Even with all of the infection control strategies, it's worrisome as a parent. And so we made a decision as a family that we vaccinated the oldest one. And as soon as the other one is eligible, we're going to have him vaccinated too. And, I think we're just trying to talk that through with people that we know. These are the decisions that we've come to as a family.
Dr. Franco said something that I think that's very important, is that you have to acknowledge people's the hesitancy that they have and where it's coming from. So and be honest about the things we don't know, because there's a whole lot about this we don't know, and you acknowledge that. When we talked about the overall long-term safety, we don't know. We have some pretty good ideas, but we don't know with a certainty. And so when people hear things that that doesn't fit with with maybe what they're expecting, they're a little more resistant. But if we acknowledge, okay, I understand why you're hesitant. I understand why you might be fearful of this, or why as a parent you're concerned about your child getting vaccinated. And I think when you acknowledge those things, people can hear you in a different way than if you come at them, as you're stupid, or you're just making things up, or then they become defensive and they don't hear anything after that.
Gotcha. And next we have a question from Nina Ross. Here's her question.
I think maybe if they would talk more about the success rate and how that looks versus the negative information that's out now, with people saying, hey, we were vaccinated, but we still got COVID. I think if they could debunk that would maybe help some people come off the fence.
So I want to paraphrase kind of a question from that, which is, what is the definition of successful vaccination in this context? Because from my understanding, it doesn't mean that you will never get COVID. It means that you're less likely to get very sick from COVID. So can you just talk and expound upon that?
I think there's several ways you could probably view or even acknowledge success. Obviously, when you look at vaccinated, unvaccinated, I think that's kind of the starting block as to say who gets COVID, who doesn't, and you start looking at rates of infection. Then you can start looking at comparisons between vaccinated and unvaccinated of hospitalization rates, ICU rates, and even fatalities. So when you start looking at comparing, or start defining what success looks like, we know as information is coming out that we do know that people who get vaccinated will get COVID. It's a low rate, but at the same time, if you do get it, that your risk of severe disease or hospitalization dramatically goes down. And you start comparing that to people who are not vaccinated, it tells a much different story. So I think it's important to highlight the effectiveness and what the true impact is on individuals and their ability to maneuver through and recover from COVID versus the unvaccinated. It tells two different stories.
Gotcha. And if either of you want to jump in on that as well, the definition of a success for this vaccine.
Yeah. So, I think one of the things too that we've forgotten, right, is that there have been other major healthcare scares in our history. So with the polio vaccine, that's one of the most significant successes in this sort of vaccination battle against certain types of diseases that have had a profound impact on our society over time. When you go back and really look at that, the breakthrough infection rate even with the polio vaccine in place was still between probably 10 and 15% of people with that protection still getting polio or getting some version of polio. And so I think one of the things is we've forgotten. It's been easy in a sense for us for several decades, right? Things have been kind of cruising along, and we haven't had some of these scares come up in the same way. It's time for us to remember, right? What have we done in the past? What have we experienced in the past in terms of public health? And take some cues from those past situations. So for me, when I hear there's maybe a 5% breakthrough infection rate with the COVID vaccine, I hear success. But I think that doesn't maybe sound like success to the general public because we haven't had this conversation in a long time.
Right.
Gotcha. Did you have anything to add, Dr. Izard?
Yeah. Again, Dr. Frank always makes good points. I think we need to manage expectations. And even going into this, I tried to explain to people that at some point we're all going to get this, and that the idea is, even with the studies that were done with the vaccine, and those studies, they did not say that people who were successfully vaccinated or immunized, that they did not get infected. What the test really tested was, did they get sick? And so when people heard that that we had 95% efficacy from the Pfizer vaccine, people heard, oh, I'm not, if I take the vaccine, I'm not going to get infected. In reality, what we found out later is that, yeah, some people did get infected. They didn't get sick, and in fact, they didn't get sick enough to even be able to record them as having COVID, because they didn't know they had it. So, we do have these asymptomatic people that would not have shown up in initial studies as being positive, because that study did not look at that. It looked at who ended up in the hospital, who had symptoms of COVID, and who didn't. So again, with anything, it's always about trying to manage expectations. If people are expecting more, they can deliver, they're going to be disappointed. So going forth, we got to make sure that people have a realistic expectation of what's going to happen. If we tell people the vaccine is safe, and they take the vaccine, they get side effects, but no one told them that they're getting side effects, then they feel like something's wrong. As opposed to, if you tell them ahead of time, yeah, this, you might get this, you might get that. You're not gonna, die from it. You're not gonna, it might be just a couple days. You have symptoms, and if it happens, then they're expecting it, and then they're okay with it.
Gotcha. And next up, we have a question from Saba Ali.
I know people who work in healthcare who are still not sure. They were really waiting for the full FDA approval. I haven't followed up with them after the FDA gave the full approval to see if they got the vaccine or not after that, but that was what they had told me initially. I know other people, younger people who are just, they know people who they got it and they weren't that sick, so they're just kind of like, if I get it, it's no big deal. And then, so I've really heard like a lot of different things from different people as to why they chose not to.
So yeah, from that, I'm just gonna grab a question from that, and that is, can you talk about the vaccine's impact on young people, and this virus, this particular variant, especially this variant's impact on younger people compared to what we saw earlier in the pandemic?
I'll try to address that. So, in the beginning, we heard the devastation that it has impacted kind of our older generations, and we weren't seeing a lot of younger individuals succumbing to COVID. With the introduction of vaccines now, obviously our older generation are really well vaccinated, but now it's our younger generation that's lagging behind. As a result, obviously we're seeing more younger individuals getting COVID, but at the same time, we know that COVID in younger people don't have the same illness course. Some may have very asymptomatic, very mild, moderate, and rarely do we see younger individuals, and I'm talking younger, like less than 35, run the course of severe disease in the hospital. So, it's kind of, it's counterintuitive to think that, COVID is going to react the same in everyone. And as a result, we're seeing a much different picture on the front lines where, yes, young individuals do get COVID, but it's equated to as maybe a bad cold at worst, maybe a bad flu, but for the most part, they recover and do absolutely fine within a short period of time. So it gives a false impression for younger individuals who I think feel their invincibility and being able to handle this and recover without any problems. It gives a mixed message to, let's say older age groups that may feel the same way, but obviously have much different courses and even fatal outcomes. And so we just have this entire spectrum of age groups that obviously are impacted very differently, and that's the hard part. That's the hard part, to convey a message to younger people that this is important, not just in the reduction of transmission, but actually, transmission within families who may have older generations or who have multi-generational living. These are important factors for younger people to take into consideration, which I don't feel they do all the time. So,
yeah. And I'm sorry, I'm just going to jump in here. I'm going to tie this to a Facebook question that we got, is if you can talk about some of the risks associated with this more prevalent Delta variant strain versus the earlier strain, how that impacted young people. And this person was asking, why are kids getting it now? And I think that that's somewhat related. So if you could talk about those two things.
If I can just,
Dr. Ignace, go ahead.
I just wanted to sit on the sort of young and old thing for just a minute, and really in terms of the communities of color that I think we're trying to think through and talk about in part in this discussion. So, and I don't mean to speak for the Native American community, but I've been working with some Native American leaders who actually are touching the Gerald L. Ignace Center as well. And one of them mentioned to me that it's, in a sense, it's easy for people to forget that there aren't as many elders as we think in our communities of color, particularly in the Native American community, because of the health disparities that are there, right? So our elders in communities of color die off sooner than other folks. And I think one of the places where we can and need to activate the youth is really around this conversation of, we need the elders to be able to transmit culture. It is a fundamental imperative, I think, in our communities that we understand where we came from, that we understand the history, and I think we can actually empower our youth in defending the interests of our elders as well. And I think that's a fundamental pushback against what has become increasingly an ageist society, right? That somehow we're going to write off older people because they're not as important. That goes against everything that our cultures from the communities that we come from are about, right? And so I think that that's an important place for young people to understand that they have a fundamental and powerful role in protecting their elders, right? In protecting their community. And that's a way for us to activate even around the sort of personal sense of, it's not going to happen to me.
Gotcha.
Kind of what Dr. Ignace was saying earlier too about with Delta. It really has changed, the game, in the sense that, and this is the same thing if you look back at the 1918 influenza, Spanish flu pandemic. It started off, the first wave hit the elderly people, the sick people, people who were infirm. The second wave, though, was the one that was so devastating because it was hitting young people, soldiers who came back from World War I. So it was hitting people who otherwise were healthy, and so what we're seeing with Delta is that it is hitting more younger people now, both children and young adults, and some of that may be that there is something about the change, the mutation in the virus that's causing that. Some of it also may be that older people have gotten smart about this, and they've gotten vaccinated. The vaccination rate is there's a definite correlation between your age. If you're older, you're more likely to have been vaccinated against COVID-19. But also, they're doing the social distancing and things, and so yeah, we're fighting that not only against against the virus, but we're also fighting against this idea that Dr. Franco mentioned, that young people, they do tend to feel invulnerable things, and so but Delta definitely has made some changes, and of course we have Mu and other variations are going to be coming out over the next year, no doubt. And we're trying to roll with the punches, because as things change, every time there's a mutation in the virus, there's always a chance that we're going to break through, the vaccination, meaning that people who are vaccinated will be as susceptible as everybody else. And that's always the fear that, as we get these mutations, and of course, the more people that get infected, the more chance they're going to get one of those mutations one of those variants that's going to break through, and then we're back to square one.
And that leads directly into our next question from Zahir, who is fully vaccinated. Here's the question.
I already got my 2 doses of vaccine, and now different variants of COVID are coming. So, will the booster help to counter that different variants of COVID or no?
So I think the answer is going to be a bit complicated because we don't know what we don't know yet. But who wants to grab this one?
I'll start it.
Dr. Franco, you know, right?
I'll start it. Dr. Franco can seal the deal. So, I think it's important, and I think, as Dr. Izard had mentioned, managing expectations of the information that is out there right now. So, obviously, the vaccines, they all have their varying levels of effectiveness. And in the beginning, when it was just the wild type or the original virus, the vaccines were quite effective. We've had variants over time. We've seen the effectiveness diminish slightly. And I think the information that is coming out now certainly indicates that the vaccines are effective against COVID. So, in particular, against Delta. So, we're talking about 2 different things that can impact effectiveness. One is obviously the issue of waning immunity over time, and 2, whether or not the new variants are going to be impacted by the vaccine. So these are 2 variables that are going to be that are very dynamic, that we don't know quite yet how well the vaccines are going to match up. But when we start looking at effectiveness of our current vaccines, either Pfizer, Moderna, or J&J, and maybe start looking at comparisons of effectiveness from previous years of flu vaccine, that effectiveness is still much higher than even what the annual flu vaccines do. So it's really about managing the expectation of what we know moving forward and what the impact will be against future variants.
Gotcha. And who, if someone wants to grab kind of this in the context of boosters, what role that might play as these variants are popping up?
So the whole discussion again with boosters right now, I think it's an important issue. And I think the biggest risk groups obviously are our older generation and people who are immunocompromised. These are the individuals that will definitely benefit the most from a booster right now. If you start looking for information, data, and articles that are being published, you're going to get varying opinions on the general public booster. And again, I think, with time, in relatively short period of time, we're going to get a more definitive answer on that for the general public. But right now, I do recommend that our older generation, as well as people who are immunocompromised, would definitely benefit the most from a booster.
Yeah, we try to keep with the science, and the politics always gets in and interferes. We got 2 issues going on. One, we know that over time your immunity wanes. Okay, so if you're infected with COVID early on or you got vaccinated, we know over time that your immunity starts to drop, and so you're unable to fight off the infection as strongly as initially. But the other thing that's going on is that we have variants, okay, and they may or may not be the same thing. So if a variant comes out and it's not as effective against the variant, that might have nothing to do with how strong your initial response was or how close you are to your initial vaccine. It may be that this variant now that the vaccine doesn't work against it, or doesn't work as well against it. So that's what I think where we are right now, is trying to figure out, okay, how much of this is a matter of time, and so a booster against the very same wild type infection that was out there would help, or is this a variant that needs a different, something different tweaked to the vaccine to make it more effective? So it looks like that maybe the administration got a little ahead of the CDC on this, because right now there's still some conflicting information about whether the current vaccine is still good and whether a booster is going to actually improve and make people more, or help our immunity again.
Gotcha. And Dr. Franco, what were your thoughts on this? And also, I guess if you could just kind of reiterate that point that Dr. Izard made earlier, which is that the longer this virus is in circulation, the more chance of mutations there are, and the longer we're all kind of in this position.
Yeah, I mean, I think that's one of the things that's interesting. I mean, we've had a major disruption. I think one of the things for the general public, and we're all experiencing in the healthcare system too, is, we were hoping that the vaccine was going to be sort of the panacea. It was going to take care of everything. It was going to be the miracle that made it all go away. And, there was a sense of relief, and we can set it down, we can put the masks down. But that's not what's happening, right? We're actually having a series of changes that are happening with the virus, with, potentially needing booster shots, or maybe even going to an annual flu shot type situation is a possibility, right? So I think one of the things that we've experienced with COVID-19 in our homes, in our workplaces, everything, is some lack of surety. We're not sure what's going to happen next. And I think that one of the things that we're all having to deal with is sort of changing footing to be responsive to the kind of disruption as it unfolds. And so I think part of it is, for the general public and for all of us, is stay tuned, right? And I mean that in kind of a funny way, but also in a very serious way. Stay tuned to the updates that are coming out. It's our responsibility as citizens. We talk a lot about what the rights of people are as citizens. What are my rights as a citizen? That's incredibly important, right? But just as important in a civil society is, what are my responsibilities as a citizen? And one of those responsibilities is to remain informed and to adjust as we try to navigate through this crisis.
Gotcha. And this next question, last question, is to everyone. What's the one thing that you want people to know about the COVID vaccine, whether it's about the vaccination process or the effects, or anything that you really want people to know about it?
What I tell most of all of our staff and our clients that visit our facility at the Gerald L. Ignace Indian Health Center is the vaccines are free, they're safe, it's quick, and the bottom line that I inform all of our new individuals who want to who are questioning the vaccine, is the side effects certainly may last a day or two. I would suggest having 1 or 2 days of side effects versus 1 or 2 weeks of COVID. There are big differences. There are huge differences in side effects and complications that can come out of COVID. I personally would rather have 1 or 2 days of side effects than 2 weeks of COVID.
I would say, kind of going along with that, the ultimate question to me is this: it's a cost versus benefits analysis. Okay, and because there are certain things we know about people who've gotten infected with COVID. We know that that a number of them will die. We know that a number of them will have end up in a hospital and in an ICU. A number of them will have long-term COVID symptoms, meaning that months later they're still having problems with their smell or taste, or foggy brain, or fatigue. We know that happens, and then we know some people do fine. Now with the vaccine's been out for 7-8 months now, and there's some things we've seen, but if you weigh the risk of maybe there's going to be something out there with the vaccine that's completely unheard of, that we never thought about, that's going to happen, to all these people that have been vaccinated versus what we know about getting COVID. To me, when you weigh those two things, I mean, it's hard to say that that risk of something maybe happening with the vaccine outweighs any benefit that you're definitely going to get from the vaccine now that we've already seen. So, that's what I want people to think about in terms of your risk versus benefits, especially if you're someone who has who's susceptible. So we know that that if you're Black or Hispanic, you're more likely to have complications, and so consider that. Are you overweight? Do you have high blood pressure? And then are you older? So you consider those things. Again, to me, it just makes sense when you weigh those things. And if you have questions, ask your doctor. Ask your doctor, and they will discuss it with you about your individual risk.
Yeah. Yeah. I mean, all those things, right? And I think for me, it's really personal. During COVID, we had people that were 1 or 2 degrees of sort of separation away from us, 6 people who died, right? Those were family members of staffers that I supervise, family members of community partners that I work with. One of them was just up the block from me, and his auntie passed. We've attended 3 or 4 remote funerals for folks in California, where I come from, who had passed from COVID. My father has a long-term degenerative lung disease, and for us to be able to see him this summer, we had to all get vaccinated, right? Because I don't want to be responsible for my father's death. It's that simple, right? And so I think if you think about it within your own family, you can also see that we also have an obligation to those around us in our community to try to stop the number of deaths. 300,000 felt like a lot. Now we're at 600,000. We're approaching 700,000 deaths in the United States. Those are people that we know and love.
Yeah, that's very, very important. And thank you for sharing that. And we want to thank everyone for joining us as well as our panelists here. And a special thanks again to my colleague Sarah Volpenheim, who went out and reported and got those videos for us. This has been another installment of ListenMKE, a partnership between WUWM, Milwaukee's NPR, the Ideas Lab at the Milwaukee Journal Sentinel, the Milwaukee Public Library, and Milwaukee Public Television. Thanks so much, and definitely stay safe out there, everyone.
Thank you.
Thank you.